During an episode of care, a patient can potentially be treated by a number of healthcare professionals. This could include general practitioners, physicians, paramedics, nurses, healthcare assistants, surgeons, occupational health, and physiotherapists. Effective communication at each stage of this journey is vital to ensure patient safety and continuity of care. In this video, I'm going to show you an effective communication tool that is widely used in healthcare setting. The communication tool is known as SBAR. This is an acronym for Situation, Background, Assessment, and Recommendation. The SBAR was originally developed by United States military in nuclear submarines to ensure effective communication. Breakdown in communication is a common cause of errors, mistakes, and complaints. The SBAR tool has been introduced in healthcare setting to improve communication, to make sure that communication is standardized and is effective and clear. If you're new to this channel, hi, my name is Dr. Erwin. I help high performers create habits to lead a happy and successful life. I publish new video on the subject of happiness and success every Thursday. Don't forget to subscribe for more videos. In this video, I'm going to show you how to use SBAR. Studies have shown that the use of SBAR in healthcare setting improves patient safety. In my practice, I commonly use SBAR. SBAR is a communication tool that you can use verbally, and you can also use SBAR in writing letters. For example, if you have to write a letter to a consultant to refer a patient, then you can use the SBAR format, and that will help you to have a succinct letter that will communicate exactly what's the situation, what do you think, and what would be your recommendation. So it's easier for the other person when they're reading this letter to know exactly what you'd like out of this referral. SBAR can also be used in acute setting. If you're seeing a patient in your surgery and this patient is acutely ill and needs admission, then you might have to speak to the doctor at the hospital. When you speak to the specialist, then you can use the SBAR tool so that you communicate effectively. SBAR tool can be used by all healthcare professionals. So if you're a doctor and you need to speak to a nurse, then you can use SBAR, or vice versa. If you're a nurse and needs the doctor, then you can use SBAR. Paramedics also widely use an SBAR communication tool. Let me give you an example how SBAR is beneficial for both the user and the receiver. Imagine a pediatric registrar working his night shift. He sees a 5-year-old who is coming in, and he's very worried about this 5-year-old and he needs senior input. So what he does is he rings his consultant in the middle of the night and he wakes up his consultant. Now, if he's used the SBAR framework, what the SBAR will do is that it will help him to clarify his thoughts and to think about exactly what's the situation we've got here. What's the background of this patient and what his assessment has been? What does he think is going on? And he also can think about some suggestion. What's the recommendation he would want from his consultant? So what the SBAR does is that it helps the pediatric registrar to gather his thoughts, to clarify everything in his mind, and to organize his thought so that when he presents it to his consultant, it flows easily. Now, as a receiver of this communication, the consultant who's just woken up is probably annoyed because he's been woken up in the middle of the night, and he's probably going to take a few seconds to gather his thoughts. So if you present the communication that you need to in a standardized and structured way, when you do it in the SBAR format, it helps the consultant when he's listening to the story to anticipate what's going on and is familiar to this kind of communication. It's more digestible for him to actually listen and process the information if you're giving it in this framework, rather than if you were going to give it in some sort of way that's not organized or that's all over the place. That's just going to confuse the consultant, and the consultant might ask himself, why are you calling me in the middle of the night? Whereas if you're using the SBAR, your information is clear and you know exactly what's the reason you're calling the consultant and what you want out of the conversation. So this is why when you use the SBAR framework, you're going to make good use of the time of your consultant, and you're also going to appear that you've done your work, you've done your assessment, and you know exactly what you'd like to do next. So this is an acute scenario where a pediatric registrar is ringing his consultant in the middle of the night. Now, this can also be used as a communication tool when you're writing a letter. You've just seen somebody in your clinic and you need an opinion from a cardiologist, for example. If you're using the SBAR framework, then when you're writing your letter, you can put in a few lines what exactly is happening. So what's the situation? This is Mr. X who's presenting with palpitations. Then you can give a bit of background about the situation. So does he have any family history of sudden cardiac death? Does he have any family history of any heart problems, or does he suffer from any heart problems himself? And then you can write about your assessment. What was the pulse like? Was it regular, irregular? Was there an ECG that was performed? If so, what did the ECG show? And then you can put in your recommendation. What do you think that the patient needs next? Maybe you would like the patient to have a Holter monitor to check the rhythm of the heart over a 24-hour period. So this is where the SBAR framework is very useful whenever you're writing a letter. In this way, you're making sure that you're communicating the relevant information in a succinct way. If you're new to using the SBAR tool, then it can be a bit difficult in the beginning because you've not been using this structure. However, with practice, you get better at using it, and it will also become a second nature the more you use it. Let's go through each step of the SBAR framework. So first of all, you need to introduce yourself. You need to introduce yourself with your position and where you're calling from. So check also who you're speaking to. Once you've checked that and made the introduction, then you need to give some information about what's going on, what the situation is. An example could be, hi, my name is Dr. Kwun. I'm calling you from University Medical Practice. I've got a 60-year-old gentleman who's presenting with chest pain. So this is the situation. Just in one line, you can say succinctly what's the situation. So the other person already knows why you're calling them now. The next step is B for background. In background, you need to give more information about the patient. The key here is to give relevant information. You don't need to go through the whole history of the patient, their whole lifetime, every time they came to see the doctor. The main thing is to give relevant information about this presentation. So if you're having a patient who presents with chest pain, then relevant information would be if they've had any surgery recently. That would help you to think about whether there's a clot here, or if they've had any heart problems in the past. Did they have history of angina or MI? So in background, an example would be Mr. X underwent right hip replacement a week ago. He also mentioned that he had some pain in his calf, and he's recently developed this chest pain, which sounds to be pleuritic. So this background is concise. It tells a lot because it tells you that this patient underwent surgery and that he has a risk factor for developing PE or DVT. So another thing in the background is important is to check what medication the patient is on and whether they do have any allergic reaction to anything. Another element of information in this background is to say whether this patient is on any anticoagulation or is having any injection of Clexane, because that would actually make a big difference in the risk factors of developing a clot. The third step is A for assessment. In assessment, you need to explain what you have done and what is your finding. So if you examine the patient and you've measured the observation, then this is where you tell the other person what were the observation, rest rate, observation in terms of saturation, blood pressure. If you've auscultated the lungs or you've had a feel of the calves, then this will be where you will actually share this information to the other person. And then you could also categorize in terms of your assessment, how serious do you think this is. So an example is On assessment, Mr. Smith is tachycardic with a heart rate of 120 and tachypneic with a respiratory rate of 25. His saturation is 95% on air. On auscultation of the lungs, there was no signs of crepitations and there were good air entry. On examination of the calf, there was some swelling in the right side and tenderness. Based on my assessment, I believe that Mr. Smith has developed a DVT which has resulted into a PE. The next step is a final step. So this is our full recommendation. In this step, you need to verbalize exactly what it is that you'd like the other person to do. Following the SBAR framework is very useful, particularly when you have to discuss about a complex patient or when you're very stressed when you're communicating to a colleague. So when you're using the SBAR framework, what it does is that it's going to gather your thoughts and make sure that you're communicating effectively. And the other person will also be able to understand what you're saying because it's in a structured way and they anticipate what you're going to say next instead of interrupting you because they know that you're going to use the SBAR framework and that the information that they might want is going to be conveyed to them. If you're new to SBAR, it might be helpful if you write it down on a sheet of paper. So write a section for SBAR, and when you write down each section, what it does, it's going to organize your thoughts, and putting it on paper in writing will help you to think about each process, what you're going to say. The more you practice at doing it, you'll find that it will come more naturally. If you find this video useful, don't forget to smash the like button. This really helps the channel to grow. I hope you find this video useful. Thank you for watching till the end. Take care everybody. Bye bye.